So for those of you who are regular Roundtable members, you'll recognize that I do not look like the chair of the Roundtable, nor do I have his skill at moderating meetings. You will soon find out. But I will try to do my best because he's delayed by the weather, as many other people are today as well. So my name is Andrew Pleasant. I'm the Senior Director for Health Literacy and Research at Canyon Ranch Institute, located in Tucson, Arizona, and my task for the day is basically to keep you all on time. So thank everybody for coming that's here, as well as via the webcast. And those of you on the Twitter sphere and social media can drum up all the webcast business that you would like. That would be lovely. I just want to say, today's workshop focuses on the implications of health literacy for discharge instructions. And everybody should know that the meeting is being recorded and videotaped. So if you don't want to be recorded and videotaped, you could raise your hand, but it's probably too late for that. So the Roundtable on Health Literacy focuses on building partnerships to move forward the field of health literacy. As one of our major activities, the Roundtable sponsors workshop for members and the public to discuss issues of importance and concern, such as what we've convened today. We are very pleased to convene this meeting to discuss the ways in which health literacy can facilitate the preparation of understandable discharge instructions and after-visit summaries. They're also required by the Centers for Medicare and Medicaid Services and the Joint Commission on Accreditation of Healthcare Organizations. However, discharge instructions are often written beyond the comprehension level of patients, and research has repeatedly shown that many patients do not understand the instructions that they receive. So this is clearly a serious issue which the field of health literacy needs to address, thus we're here. It is our hope that this workshop will serve to expand the network of those involved in health literacy innovations and problem solving. We also hope the meeting will foster additional dialogue among existing organizations and individuals about the importance of and the possibilities for health literacy efforts at many levels. I think you'll note that we see a lot of new faces, both as speakers and in the audience, so the meeting seems to have already accomplished some of that. I would ask each Roundtable member to be noting throughout the day key ideas or concepts that are brought out in the presentations and the discussion. At the end of the day, I or George, if he actually shows up, one of us, will go around, as is our custom, and ask each of you to briefly describe the key highlights from your perspective. This workshop was organized by a planning committee, and I would like to thank them. That was, the committee included Darren DeWalt, who will be joining us via telephone because of weather issues today, Bernard Dreyer, Alex Fetterman, Ruth Parker, and George Isham. We will begin with a presentation that provides an overview of why rules and regulations about discharge and after-visit summaries were developed, as well as the implications of such policies. The second presentation will provide an overview of what we know about current discharge and after-visit summary materials. And the third presentation of the first session this morning will address the link between discharge and after-visit summaries that are constructed in a health-literate manner and reaching improved outcomes. So please hold all your questions until all three presentations have been completed. Melissa French, please, there you go, will be your timekeeper. She will give you a 5-minute, a 2-minute, and your time is up warning. So start wrapping up at 5 because it'll take you that long to wrap up. And Darren, we will just shout at you over the phone somehow if you're listening yet. So of the first three speakers, the first one, Dr. Josh Seidman is a consultant to the Brookings Accountable Care Organization Learning Network. They support physician-led ACOs to use data better to manage population health. His prior positions include overseeing quality and performance improvement at Evolvent Health and serving as director of meaningful use for the Department of Health and Human Services, where he was responsible for the Office of the National Coordinator for Health IT's policy development around the meaningful use of electronic health records and equality measures, and that's one heck of a sentence to get out on one breath, I will just say. So our second speaker, Dr. Alex Fetterman. Dr. Fetterman is an aging-focused health services and behavioral health researcher and associate professor of medicine at the Icahn School of Medicine at Mount Sinai. His research addresses issues of chronic illness self-management with a focus on health literacy, cognition, and health-related beliefs. He also provides primary care to adult patients in the Internal Medicine Associates practice in East Harlem, New York. And the third speaker, who again will be joining us via phone, Dr. Darren DeWalt. Dr. DeWalt is an associate professor in the Division of General Internal Medicine at the University of North Carolina at Chapel Hill. Darren is board certified in pediatrics and in internal medicine. He actively researches self-management interventions for patients with low literacy and focuses on chronic diseases, and his focus on patient-physician communication and health system design to achieve better outcomes for vulnerable populations is known to many of us in the room. So Dr. Seidman, it is now your show. Thank you.